If you've been in a hospital where there are sick patients for any period of time, so any kind of ICU you think, or any ER, and you need to assess for a patient's level of consciousness, there are 4 levels of that. Are they alert, lethargic, obtunded, or comatose? There are only 3 different ways to assess for that. There's sternal rubs, which people often do. There's a trapezius pinch, which people don't do that often. Maybe if you're already at the head of the bed or anesthesia or doing some airway thing, maybe. And there's pressure on the supraorbital rim. Notice I didn't say nail beds or toenail beds. Those don't assess for central stimuli. That's a peripheral nerve thing. So it's just mean. Notice that this is specifically for alertness. This is different than when you're in a setting of trauma or otherwise looking at GCS. Are they posturing? Are they extensor posturing? Or in a stroke patient where you're trying to assess for strength, if they have no response even with painful stimulus peripherally and they're alert, that's a 0 out of 5 strength if there's not even a flicker. So whenever you're intentionally doing something painful to your patient, you need to know you're doing the right thing. If you're assessing for alertness, you have to do one of those 3 things. If you're assessing for strength or GCS in the setting of trauma, then you can do peripherally. You just got to be intentional.